Car, medyo gumaganda na, mukhang gumaganda na yung mga ano natin, no, mga numbers with regard to COVID transmission, naglulubog na economy. Now, people are worried. They're looking at Europe and the US. Nagre-research yung transmission as their economies reopen. Tayo, paano kayang dapat gawin natin to sustain our gains, hard-won gains in the past 7 months?
I think, I think we really need to go to the fundamentals of things. No, again, prevention, detection, and tracing. Unless we can get those really in place, mababawi lahat ng gains natin if we continue opening up without putting these measures in place. Yung physical distancing, yung masks, and face shields na kailangan maging part na ng prevention natin. At the same time, community should know what to do immediately in terms of detecting cases, contact tracing, and isolating contacts if ever. Sa lahat ng yan, nararamdaman natin sa Metro Manila kasi dito pumutok una. So we can feel it here that people are doing that. But as the infection transmission goes to the provinces, that becomes more problematic. In fact, habang lumiliit sa Metro Manila, tumataas naman sa probinsya. So even the question of transmission, even if our numbers are looking good, we cannot really say that transmission is already controlled. And that's a problem. And that's something we need to look at. Maybe in Metro Manila, things are looking up. And the economy is becoming the main reason for people to go out. But in the provinces, where the healthcare system might not be that strong, definitely weaker than Metro Manila, magiging problematic pag doon pumutok. And right now, di ba, maraming dumarating na OFWs, mga migrant workers pupunta sa probinsya, maaaring sila yung magdala ng infection, no? Hindi natin alam. And that that's where we need to have our national system coordinate with the local. Ang isang nakita natin problema dyan kasi yung national leadership ng health at parang pinapasa sa local government yung obligation. Kaya nagkakaroon ng gaps.
Dr. David, if you don't mind, I just want to get to a couple of areas that you mentioned, that you highlighted. Lucena, Quezon, 8% attack rate, and now you're saying hospital occupancy, 95%. That literally means halos wala ng capacity sa Lucena. And then I just throw in there, Bawan naman, Batangas, higher attack rate, but you're saying 0%. What does 0% hospital occupancy mean?
Oh, actually, it's supposed to be NA. It means that we did not find any hospitals in
Bawan,
Batangas. So most likely, that's the cases there, they get hospitalized in a different LGU, perhaps Batangas City. But anyway,
yung sa Lucena,
we found hospitals there, and it's the center, so most likely the cases do go to Lucena for hospitalization. Although Bawan, Batangas, we're not that concerned because their caseload is actually quite low. Mataas na yung attack rate nila, so we featured them the previous week. Pero right now we're saying, well, okay, let's now look at the caseload as well para hindi naman, kasi itong mga ibang matataas yung attack rate, mga like yung Gamo, Isabela, I mean, they might be getting only 5 cases per day. So it's very manageable. Mataas lang siya relative to the population. But we still have to be worried about those places na mataas yung, they're getting 20 cases per day and still increasing. And especially if their hospitals are getting filled like Lucena, we definitely have to be concerned. And that's why we're putting these reports para to alert people. I know may mga ibang nagagalit yata sa amin for informing people, but I believe it's the right of people to be informed. Lalo na when we're opening up the economy, now the responsibility is on the people.
But Professor, how worrisome is it, yung situation outside Metro Manila? Because Dr. Nisperos also mentioned this, na although nag-i-improve daw yung numbers in Metro Manila, outside actually yung capacity ng local governments, hindi siya nag-i-improve, and we are actually seeing, well, sa ngayon, mga pockets of an increase or a resurgence or an appearance of the virus. How worrisome is that situation?
It's a bit worrisome. Pero, I mean, yes, we're seeing an increase in Isabela and in places now we didn't see an increase before. And there are many places where we're seeing an increase, and in Mindanao, in places like Butuan. Pero, of course, these are far from Metro Manila. If we're thinking about Metro Manila, we should be concerned about increases sa neighbors natin. And we're seeing an increase actually in Rizal, in places like Antipolo and Taytay. So they're having bigger numbers, and Cavite is not seeing an increase yet, but they still have big numbers. So definitely, if we have looser border restrictions, we have to be concerned, because even though we're improving, and right now we're only improving slightly sa Metro Manila, we're not improving as much as before. So we even have to be cautious, even with just that fact. Pero nevertheless, let's say we're improving, we still have to worry about our neighbors where there is an increase and we have loose border restrictions.